So I'm here today to talk about our Intensive Dietary Management Program based in Toronto, Ontario in Canada. This is your neighbors north to the border here. So I co-founded the Intensive Dietary Management Program in Toronto about 4 years ago. So in the Intensive Dietary Management Program, we focus on fasting protocols and a low-carbohydrate diet, preferably ketogenic, but we work with our patients to combine what they're comfortable with in making changes in their diet with intermittent fasting. So for our patients who don't want to do more fasting, we really emphasize a ketogenic diet. And for our patients who aren't too keen on changing their diet very much, we focus on more prolonged fasting regimens. Before I talk to you a little bit more about how the program is structured and how we operate here in Toronto, I'm just going to tell you a little bit about the history of our program. So most of you are more familiar with my colleague here, Dr. Jason Fung, your intermittent fasting Yoda. So I've actually worked with Dr. Fung for 18 years. I couldn't even legally drive when I started working with him. Dr. Fung was a new nephrologist fresh out of his fellowship program, and he joined a nephrology team in Scarborough, Ontario, which is a borough of Toronto. And he was very keen on doing a lot of research, particularly research that focused on biomarkers for detecting renal disease or kidney disease much earlier than our current biomarkers enable us to do. So he needed a student, someone to help him put all of this stuff together and all of his research projects and actually execute them. So they paired me up with him. So we were both young kids, he was married, no kids yet, I couldn't drive, so I've been working with him for a long time. So both Dr. Fung and I, we specialize in nephrology. Dr. Fung is a medical doctor, and I'm a clinical researcher. So I would execute all these prospective studies, analyzing the progression of our patients' kidney disease, looking and seeing to try to determine if there are better biomarkers so we could detect kidney disease much earlier than we presently can. But when I actually started adult life outside of university, I started getting into a more regular schedule. I had my evenings back, and I started being able to eat and snack and graze and having proper meal times, and I started to pack on weight very quickly. And my weight quickly went up, and my health quickly went downhill. And at the same time, Dr. Fung was getting really, really frustrated because the majority of his kidney patients had kidney disease because they were diabetic. And as the diabetes got worse, the kidney disease got worse and worse and worse. And there was nothing he could do about it. There's a few medications he could prescribe, but he had to prepare the patients for the inevitable, which is dialysis. So dialysis is life-sustaining therapy that keeps you alive once your kidneys start to fail. Dialysis does the job that the kidneys would otherwise do itself. So he was getting really frustrated, doing all kinds of research, and he was going on and on and on at meetings about how he could cure diabetes. And, Dr. Fung, you've heard him talk. He tells it as it is. He has these bold statements, and I was really busy trying to wrap up some research projects, so I wasn't paying too much attention to what he was saying. But then that's when diabetes hit me. So I actually became the first IDM guinea pig. So most patients come into the office and they meet very quickly with Dr. Fung. Dr. Fung's actually a nephrologist, and he does nephrology full time. But he meets our patients in consultation, and then he shoots them off to me for the Intensive Dietary Management Program. Most people come in and they roll their eyes, like they see this skinny, young, healthy-looking woman, and they think, what the heck do you guys know, or would you know about what it's like to be overweight and to have health issues? Well, from the time I was 24 to the time I was 26, I gained 80 pounds. I stand at about 5'2", and at my peak weight, I was 189 pounds. So as you can see, I wasn't always this tiny little thing. My previous diet, I grew up with an Italian father, an Italian grandmother who was very, very much, it was a sin if you didn't eat all of the pasta in the world. I grew up with an Irish mother. She only ever gave us potatoes and corn. So if we weren't having pasta and bread, we were having potatoes and corn. And then I married this Puerto Rican guy and have Puerto Rican in-laws. So patients come to me in clinic all the time and they say, I don't understand the cultural significance of certain foods in their diet. Give me a break. I've got them all. I've got everything. I know how hard it is to give this stuff up. And fortunately, growing up too, I had a lot of freedom when it came to my diet. My parents were very busy. My mother was very sick growing up. If I didn't like what was being made for dinner, then, okay, honey, order a pizza, or I'll tell your father to stop off and pick up McDonald's on the way home from work. So I've had metabolic syndrome most of my life. So I actually think I've had metabolic syndrome from the womb. My mother was 4'11" and she gave birth to like a 12-pound baby. So I was pretty unwell from the start. But I was always sort of obnoxiously skinny, and no one understood how I was so skinny for most of my life. But I was actually diagnosed with fatty liver disease at the age of 12. But my doctor at the time, she didn't care. She said, well, you're thin. You'll grow out of it. And I was like, okay. I was 12, so I didn't think much of it. And my parents weren't too concerned. Everybody was just concerned about my BMI, and my BMI was actually low. So they just thought I was just a strange medical phenomenon at the time, and I would grow out of it. Then at the age of 14, I was diagnosed with polycystic ovarian syndrome. And it was really painful and unpleasant, and I became very scared that I wasn't going to be able to have kids, because this is what they kept saying. And anything I read online at the time, it talked about PCOS and infertility or fertility issues, and I've always wanted to be a mom more than anything else. So it was really scary. But then again, my doctor and the specialist she sent me to, after my diagnosis, they said, but you're so thin, you'll grow out of it. Well, even though I was so thin, I had next to no energy. I would have to come home from school and nap for a few hours before I could do homework. I played a lot of sports, but not a whole lot of endurance sports. Let's just say that. I was more of a sprinter. I was like a greyhound. Run really fast for 30 seconds and then sleep for 6 hours afterwards. So I was able to maintain skinny fat throughout university. But in hindsight, looking back, even though I ate like crap, I fasted all the time. Sometimes days would go by and I would be so hyper-focused in my studies, I couldn't tell you when the last time I ate was. So even though I lived off of pizza and McNuggets for several years, I didn't eat very often. And I think that's why I finished university at the same weight that I started university at. But then an adulthood set in, and I thought, okay, I've got to get it together. I've got to be eating proper meals. I've got to be snacking several times throughout the day to stabilize my blood sugar levels. And it wasn't until then that I went from skinny fat to just flat out obese. So I gained a ton of weight. I felt horrendous about myself. As a young woman, you're very, very body conscious. I started working with personal trainers and dietitians. The dietitian accused me flat out of like hiding in my bedroom and eating Oreo cookies, because there was no way that I had this weight gain without eating copious quantities of garbage foods. So I was doing the calorie-restricted diet. The longer I dieted, the more difficult it became to lose weight. I had no energy. I broke down one day crying at home. I just came home and I saw this big pile of laundry, and I said, I don't have the energy to do that laundry. And maybe it might be a good thing that I can't have kids, because I can't even take care of myself. So I was really frustrated. And then the worst thing happened. I got diagnosed with Type II Diabetes. My hemoglobin A1C was 6.4, and that's sort of on the border range of being diagnosed as diabetes. So it's technically borderline diabetes. But I was in denial. I definitely knew it was coming. And like several of us were talking last night in the front foyer here, A1C is not the best biomarker used to determine diabetes. I was already having protein spill out into my urine, which is one of the earliest signs of diabetic kidney disease. And I was having the neuropathy pains at night. So I knew it, and I was just totally in denial about it. I was also simultaneously diagnosed with osteoporosis. I was a diet soda junkie. I probably drank close to 14 to 18 cans of this stuff a day. Not a coffee drinker. Wish I was. I'm not abstaining for health purposes, let me tell you. 1 cup of coffee a day I think would make my life a lot more pleasant. But I was a diet soda junkie. So 27 was not a good year for me. It was the best year, and there was the worst year, and yet the best year of my life. And the reason why it was the best year is because one day I knocked on Jason's door and I said, I don't know what to do. I said, as a clinical researcher, it's my job to track people dying from diabetes. And I said, I'm so young and I want to have a good life. And we know, what is this research that you've been squawking around the office about? And how can I start out fasting? And he said, well, you know, Megan, nobody here wants me to fast a patient. I said, well, I'm not a patient. They can't stop me from fasting, and they can't stop you from helping me. So we started out with me as guinea pig number 1. So initially when I started fasting, I thought, oh, I'm young. I can fast for like a month if I wanted to. So I set out to do a 14-day fast. And well, actually at about hour 18, I thought I was going to die. I saw Jason in the hallway and I wanted to shake him and tell him to take me to McDonald's and end my misery. Jason Fung's he's lucky he survived my first month of fasting, actually. So I started out doing 3 24-hour fasts a week on my busiest days at work. And then I increased my fasting hours slowly over time as fasting became more and more easy. And I achieved most of my success doing intermittent fasting with 42 hours of fasting and shorter bursts of fasting with 72 hours of fasting. I started off my diet journey still eating like crap. When you've only ever eaten boneless, skinless chicken breasts and potatoes and pasta your whole life, and every morning you ate fresh Italian bread growing up, it was really hard for me to change my diet. So I started with a fasting, but the fasting helped give me more control over my appetite, which then made me, it made me more welcoming to trying these new foods and trying to include more fat in my diet. And eventually, I now follow a full-blown ketogenic diet. Something else that I focused on was eating in time-restricted eating windows on our eating days. And this is something that is very important in our clinic because not all of our patients' diets are perfect. There's always holidays and celebrations and birthday parties and things popping up all over the place. So we really try to contain the feasting periods a little bit on their eating days. And this is something I'll touch base on a little bit more later on. So I cut out breakfast also, and I cut out snacking. Snacking nearly killed me. I used to eat about 40 cups of popcorn every night. Regardless of whether I was hungry or not, it was out of habit. So I followed this diet for about 6 months, very, very consistently. And over 6 months, I really sort of radically changed my diet. I lost 60 pounds. And my hemoglobin A1C went from 6.4% to 4.6% within 6 months. Upon ultrasound and a FibroScan of my liver, there are no signs of fatty liver disease, and I started having regular menstrual cycles for the first time in my life, starting in the 3rd or 4th month of my fasting regimen. Fasting definitely was not easy to start with. It was very difficult, but I knew the fasting was enabling me to make better meal choices, and I was getting results, and nothing I had done previous to this had given me any results. So I said to myself, okay, Megan, if you were diagnosed with cancer and they told you had to have the combination of chemotherapy and radiation for 6 months, you would do it. No questions asked. And it would suck. It would absolutely suck, and you'd feel like garbage from time to time, and you would miss out on all these important social events every now and then if you weren't feeling well, but you would do it. And diabetes, I'm just going to die from it. So why wouldn't I take 6 months and work my butt off and maybe not feel so great all the time and maybe sit out on a few social parties? But if I get to live a healthy life, and if that means that I get to have kids later on too, well then, damn it, it's worth it. So I started and I pushed through, and it became second nature to me. I actually really enjoyed the freedom of fasting, and this is what we hear from a lot of patients all of the time. They're so busy on their day-to-day lives that they have to make time, a whole lot of time, set aside to cook and to cook healthy and make healthier choices. And they said they don't have that time. So it makes them start to loathe food and loathe the cooking process. So then they just give up and then they start eating all these bad foods all over again. But with the fasting, they get to fast and they have freedom. And then that way when they do have time to eat, they have all of this, available time to sit there and plan out the menus and really enjoy cooking and develop a more positive relationship with good, healthy foods. So I'm about 5 years out now. I'm now down 80 pounds. Now initially when I lost 60, I thought, okay, this is pretty good. If I can maintain 40 of that 60 pounds of weight loss, I'll be pretty happy, because I never thought weight loss was sustainable. My father's a trial lawyer, so his stress level's through the roof. And growing up, I watched Daddy gain and lose 100 pounds every 6 months throughout my whole life. So I didn't think weight loss was sustainable, but I thought it'd be pretty good if I could maintain 40 of that 60 pounds of weight loss. Well, I ended up losing an extra 20 pounds. My hemoglobin A1C when last checked was March of this year, and it's 4.5%. So I've still stayed within that 4% range. And what's probably most impressive that I don't have on the slides here is that my fasting insulin was 304, or in US units, it's about 45. And it's now down to 10, which is just under 2. And so I've come a long way, and I've been able to maintain pretty wonderful results. Still no fatty liver, still no PCOS. I got checked out before I got married because I didn't want fertility to become a marital issue. I got married about 2 years ago, well, a year and a half ago, sorry, honey. Feels like a long time, I'm just joking. But I didn't want it to become an issue later on. And they said, you are good to go. All my markers look great, and anatomically, I look to be in great shape for having kids. And now I have osteopenia. So I'm hoping by the end of this year, I'll have no bone mass density issues. My mother actually fractured her hip at 36 without incident. She didn't fall. She just lost the ability to walk, and she was admitted to hospital for 6 months before one of her nurses freaked out at her doctor and said, X-ray this woman's damn hip. She has a broken hip. So the osteoporosis diagnosis was really scary for me. So I'd say I'm winning overall, and I owe this to my fasting Yoda, Dr. Fung. So I'm really honored to be working with him on this program. I gave up my research in nephrology to focus on executing this Intensive Dietary Management Program, also known as the IDM Program, within our city of Toronto, and now we're trying to expand globally to help people out that are not able to come into Toronto and see us. So the Intensive Dietary Management Program, we do have a small in-office program. That's how Dr. Fung and I started, and everybody thought we were wacky. The only people who didn't think that we were wacky were our colleagues who saw my transformation, and my research patients who saw my transformation. And this is initially how we hooked people in. People ask me all of the time, how can we help you spread the word? And I always say, lead by example. That's how we convince anybody to start fasting. My patients saw me come back from the dead and rejoin the land of the living. And they said, we don't care what you're doing, Megan. We'll do it. If you tell us to do 1,000 jumping jacks a day and walk on our hands, we'll do it if we can have the results that you're getting. So we have a small in-office program. Now, Jason and I are busy, like you wouldn't believe, and so we're only taking on some very select, specialized cases in our in-office program in the future, so we can learn more about it. But we're trying to get most of our program online. So we have these online groups. Our participants meet in small groups for group support. When I first started fasting, the only support I actually had was from my grandmother. Now, she didn't understand why I wasn't going to eat pasta, but she did understand the reason why I didn't want to be eating all of the time. She said, when your father was growing up, he didn't eat a snack before dinner, and he sure as hell didn't eat a snack after dinner. If he needed to make sure he ate at dinner time, or he was screwed. And she said, we had potato chips for special occasions, like Canada Day barbecues and birthday parties. We didn't have potato chips sitting in our pantry on a regular day-to-day basis. There was no way. And your father didn't get fat till he moved out of my home, so that should tell you something. So I had no support but my grandmother, and my family didn't care because she had dementia. And they said, you really can't use her as your advocate here. And so I had Jason, and I spend most of my life with Jason on a day-to-day basis, but he wasn't also going through it at the same time. So I was getting a lot of ridicule from friends and family, and I just kept pushing through because I knew I could prove to them that what I was doing was healthy and was good for me. So a lot of the people who reach out and ask to join our program, they're sort of in the same situation that I was in previously. Their spouse thinks they're insane. Their children think they're insane. Their colleagues and coworkers are on the verge of having them committed. So we meet with our patients in small groups so they can meet a group of like-minded people from all over the world. The majority of our long-distance patients come from the United States. We also have a big patient population in Australia, New Zealand, and throughout the UK. So we meet these patients in small groups, and we provide them with fasting, coaching, counseling, and dietary education. Our program, there's no surgeries, no medications, or no supplements other than what is required for supplementation based on their blood test results, if they're lacking in any minerals or electrolytes. So Dr. Fung and I founded our program in 2014, June 5th, 2014. I remember thinking it was a scary day because this is a do or die for my new career, and we were both pretty certain that we were going to be shut down within a matter of a few months. We can't believe it now. It's been pretty crazy. And I'm sorry I have this on here twice. And we're based in Toronto, Ontario. Most people don't realize Toronto is the most culturally diverse city in the world. So we had a lot of success with our patients initially asking to fast based on my results. But when we started to see new patients in the clinic, most of them weren't put off by the idea of fasting because over 1/3 of them actually fast for religious purposes. So a tremendous number of our patients participate in Ramadan, where they fast between sunrise and sunset for a period of a month. Many of our patients, were still traditional Catholics, and they would fast on Fridays, and they would actually fast for Lent. They wouldn't give up beer for 40 days. They would actually fast. We have a ton of patients too who are Greek Orthodox. They fast for nearly 200 days of the year historically. So we didn't have a lot of problems getting people to fast. I think maybe if we were in any other city in the world, we would have had a more difficult time. But because of the great diversity in Toronto, people said, oh yeah, we used to do that as kids. We have no problem doing that now. So it was being in Toronto, which I think was really key for our success. So in our program, we treat people for weight loss. We treat people with diabetes, and from the spectrum of my A1C is 5.6%, but I'm starting to have secondary side effects of diabetes. I really want to get this under control now while I'm so close to, being back in the normal range. So we had one woman come in one day on 640 units of insulin plus 4 oral diabetic medications. And her A1C was some mysterious number over 15 that was undetectable by our lab in Toronto. She's no longer on insulin. She is on 2 oral diabetic medications. As you can imagine, she must have she does have a medication, or not a medication, but a medical history that's about 3 miles long with secondary side effects. So we've had to go pretty slowly with her. But we do treat the full spectrum of diabetes. We also treat fatty liver disease. Fatty liver disease is really quite effective to treat with fasting because when you fast, your body dumps the stuff out of the liver first. So we have a lot of success with fatty liver disease. We also have 7 babies we've attributed to IDM with PCOS. So we're quite the hot little group here in Toronto, and everybody, all of Dr. Fung and my colleagues from the hospital, even if they weren't in endocrinology or in obesity medicine, they were very interested on how this fasting hormone affected everything else, and then particularly within their specialties. So we have a few OBGYNs that just send us all these ladies. They need to lose weight, their numbers are all good metabolically, but they they need to lose weight, they have PCOS, and maybe this can help them with that. So we have 7. I mean, we're a young program. Hopefully we can get that number up even higher. We also have a lot of patients who come to us with sleep apnea. Now, sometimes there's not a whole lot you can do about sleep apnea, but losing weight can definitely help improve it. But we've also taken 8 people off of CPAP machines in the last 2 years alone. We're also getting in more patients who are referred by their oncologists to do some therapeutic fasting. And we also are working with a Canadian neurologist who actually resides in New Zealand, helping treat some various neurological conditions with intermittent fasting. So when it comes to our dietary recommendations, we really enforce the ketogenic diet. I can't tell you how much a ketogenic diet's just changed me from going from a low carbohydrate diet to a ketogenic diet. I noticed an extreme improvement in my overall energy, cognitive function, ability to focus. It's been just amazing. But most of our patients will follow more of a moderate low carb, moderate protein, high fat diet. We usually try to eliminate breakfast across the board with most of our patients. So our eating days are still essentially 16 hours of fasting. And we really focus on the time-restricted eating windows. A lot of our patients opt to do 24 hours of fasting intermittently. And on their eating days, if they skip breakfast, they still have about 8 hours of the day that they're able to eat. And some of them really well eat for all of those 8 hours. They still don't have these time-restricted eating periods, and their weight loss tends to stall. But as soon as we put their meals on their eating days in these time-restricted eating windows of about 90 minutes, then their weight loss starts to pick up again. A lot of our patients, too, have a really hard time adapting to a low-carbohydrate diet. Most people don't realize this also, but 50% of the population in the city of Toronto was not born in Canada. We're exceptionally diverse, and a lot of our patients are newcomers to Canada who live in homes with large families, and they don't have the income to support having a low-carbohydrate or a ketogenic diet. So when we work with these people who are going to eat lots of carbs, or refined carbs and starchy carbs, we really focus on eating in time-restricted eating windows so they're not grazing all day long. So we usually have our patients take 3 60-minute eating windows, or more ideally 2 90-minute eating windows. And we find this to be very effective even for people who still follow a high-carbohydrate diet because of other restrictions in their lives. So we work with patients for various fasting regimens. We have people doing intermittent fasting regimens, we have people doing shorter bursts of fast, and we have some people doing prolonged periods of fasting in our clinic. So for the intermittent fasting regimens, we have 3 sort of standard ones that we follow: 24 hours, 36 hours, and 42 hours. We ask people to to try to complete 3 fasts a week, and they can vary up the fasting hours as much as they like. I got to a point where I really enjoyed doing 42 hours of fasting on Mondays and Wednesdays. Mondays, I wasn't really hungry. It made it easier because we traditionally eat mostly on the weekends. So I would definitely feast on the weekend, and Monday I didn't care to eat. So it was very easy to fast throughout the entire day. And Wednesday, well, hump day, I'm just happy to survive every Wednesday. So it was really easy to try not to think about eating anything. But on Fridays, I didn't want to fast for the entire day on Friday. I wanted to be able to go out Friday night and enjoy the end of surviving the work week and have a meal with my friends. I didn't have to eat like garbage. I could eat, some wonderful salmon and some great vegetables covered in some awesome butter. But I liked having that freedom on Friday evenings. So we encourage our patients to mix it up, and we ask them to try to aim to do 3 fasts a week. And there's always Tuesdays. I had one patient come in the other day, and she said, I've had a wedding every weekend this month, so I haven't been able to fast. But what about Tuesday? How many weddings did you have on Tuesdays? There's always Tuesdays. You can always fast one week a month, or 1 week, or 1 day a week. 24-hour fasting regimens we usually recommend for people who are looking to be more preventative, only have a little bit of weight to lose, don't really have a whole lot of metabolic complications, or on the flip side, they're extremely complicated. They have congestive heart failure, or they're on dialysis. A lot of our patients are actually on dialysis, so their fluid restriction, they get too dizzy and too unwell because they're so limited on the amount of fluid that they consume during a fasting period, so we keep their fasting period short. We also focus on 24-hour fasting regimens for our very skinny type 2 diabetics, because they tend to have very fatty pancreases when we visualize them. And when we measure some of their biomarkers like C-peptides that tell us how much insulin their pancreas is actually producing, and when we measure their insulin levels, they're actually quite low. So for these people, we want to bring those levels up a little bit. So we start off with slower fasting for them. 36 and 42 hours of fasting is what we recommend for people that are trying to lose a little bit more weight, so over 30 pounds, and people who definitely have metabolic syndrome and who have diabetes and have the weight gain with the diabetes. So fasting fluids for metabolic syndrome. When people are trying to lose weight and just trying to get their blood sugar levels under control, these are the fluids that we permit on fasting days. So, of course, water, flat water, mineral water, carbonated water, bone broth or vegetable broth if our patients are vegetarian, coffee, and tea. For people who are fasting for more therapeutic reasons in the treatment of cancer and neurological conditions, they have water and salt. And we limit it to just those two items for those patients. All right, we have some patients who find the intermittent fasting to be a little bit irritating. So it's really about finding the right fasting regimen to fit the right personality type. There's so much more psychology behind this than I initially realized, and I too experienced a little bit of this in my journey. Eventually, intermittent fasting became frustrating. I would rather just fast and eat, and that way it enabled me to grocery shop more effectively and have less food loss or food waste. So these are a couple of standard fasting regimens that people actually do on a weekly basis. Some people will fast for 60 hours at the start of the week and then take a break on Wednesdays and then fast the remainder of the week into the weekend. And some people will do just a 3-day chunk in the middle of the week when they're the most busy, running their kids around to different Girl Guides or Boy Scouts or hockey practice. And a lot of our patients, particularly those who are parents with extremely busy children, or they're people who are just sort of workaholics throughout the week, they'll actually fast Monday through Friday. And then they'll start their feasting on Friday evening and carry it throughout the weekend. And then we have people who do prolonged periods of fasting. Now, Jason would have every one of you start off with a 7-day fast, but people kept looking at him like he was just freaking insane. So we don't do that with a lot of our patients. But we do a prolonged fast of 7 to 14 days for a lot of our patients who are on a significant amount of insulin, for those who are on over 100 units of insulin a day, or for those of our patients who are looking to lose over 100 pounds. And sometimes it actually takes during a prolonged period of fast to really lower a stubborn body weight set point. So there's a lot of factors to take into consideration when determining a person's fasting regimen. I usually start a patient out on a very cookie-cutter fasting regimen. I'll ask them, would you prefer to get it done and over with in the week, or do you want to space it out? And we start off with the cookie-cutter regimen. And then we look to see what other factors play a role in their lives. Are they parents? Are they cooking? Which nights of the week are they cooking? Do they have all-or-nothing personality types? This one is exactly what I am, and it's the most scary also to work with. These people want to jump in and do 7 days of fasting all of the time, and then they get what we call fasting burnout. And then their diet goes off the deep end for months on end, and they don't do any fasting. So recognizing these personality types and these other social factors help us guide patients better. So if someone comes in and is like, Megan, I want to fast for 7 days every other week of the year, I know that they're going to crash 3 months down the road. So it's trying to coax them into doing a more shorter burst of fast more frequently so they don't burn out. The most common side effects of fasting that we see in the clinic are headaches, dizziness, and nausea. This can almost always be resolved with more water and salt. Sometimes we recommend potassium supplementation. Being kidney specialists, we see very high potassium levels all of the time, so we're a little bit leery for recommending potassium supplementation, so we really focus more on the salt. We often see constipation or diarrhea. Now, for constipation, it's only an issue if you're in discomfort. If you're not in discomfort and you haven't had a bowel movement in 7 days and you haven't eaten for 7 days, well, there's not a whole lot to come out of you. So we usually recommend magnesium for constipation or diarrhea for psyllium husk. We also see gout flare up in some of our patients who have a history of gout. So we recommend lime water and black cherry root extract. And we often see acid reflux flare up in people with histories of acid reflux. So we focus on a lemon water and unfiltered apple cider vinegar to help get them through. So these are some of the training wheels that we use to help people get over their own physiological hurdles. Most of these issues, though, they do subside within about 4 to 6 weeks of fasting. Now, a lot of people come into our clinic and expect for us to radically transform their diets right away. And we don't. We kick them in the butt and we get them started in a fasting regimen right away. And the reason why is because when Jason and I first started doing IDM, we spent weeks trying to get our initial patient cohort to change their diet. But it was always my granddaughter's 4th birthday, and it was our anniversary, and this and that, and then, well, we had a big weekend away, and we found that we really couldn't change their diet, and their desire to consume carbohydrates is just through the roof. So we gave up on that and just pushed them into the deep end and started them on a fasting regimen, and that fasting all regulated their hormones that made it easier for them to make better dietary choices. But if a person is coming off of a very, very high carbohydrate addict and would describe themselves as a carbohydrate addict, we have them do sort of a fat bootcamp diet for about 1 week leading up to their fast, where we tell them to eat lots of avocados, olives, bacon, and eggs. And usually people get all perked up when their doctor tells them, hey, you got to eat bacon and eggs. They're like, what kind of doctor's office are we in now? So it's usually not too difficult to entice people to eat bacon and eggs. We really cut out nuts and dairy during this time because we find most people don't have a tremendous amount of control over nuts, and dairy causes a lot of inflammation in a lot of our patients. So where they can have dairy on a regular basis, during this time we try to keep the dairy consumption to a minimum and focus on just these really fatty foods. And most people, even if they're coming off of a fast food diet, they do this for a few days and they start fasting very naturally on their own. So I'm going to go through a few case studies and then I'll be done, guys. I know I'm going over a little bit. So this is the case of Mr. Don't Have Children, because this is what he tells me every time he comes into the office. He has 9 of them and he keeps telling me not to have any of them. So he joined in September 2014 at the age of 75. He was diabetic for 30 years and on insulin for the last 12 of those 30 years. His other health issues were high blood pressure, stage 3 kidney disease, that's how he knew about us, and a history of gout. He was on, so initially in the program, he was taking 68 units of insulin, and he was able to discontinue the 68 units of insulin within 16 days. His blood sugars were still running a little high, around 180. So Dr. Fung did prescribe to this gentleman Onglyza, 2.5 milligrams once a day for 6 months. And within 6 months, we were able to remove it entirely. So to date, he's still on no diabetic medications. His fasting regimen was 3 36-hour fasts a week, which meant on his eating days, he would eat breakfast, lunch, and dinner. And he followed a more moderate low carb, but this man really enjoys his birthday cake on his birthday. So as you can see, at baseline, he was on 76 units of insulin. And his last marker here is from earlier this month when I saw him in clinic. And his A1C has remained at 6.1. Almost entirely since 2014. So he's almost been doing this for 3 years, despite discontinuing his diabetic medication and 76 units of insulin that he had been on for 12 years. Now, we're more concerned with our patients' body composition. We really encourage our patients to throw away their scales, and we actually stop weighing people in office because we think there's such a healthy association between what we perceive as success based on the number that's generated on the scale. People need to keep in mind that that number tells us how much bone, how much muscle mass that we have too, and that it's a heck of a lot better to have bone and to have muscle than it is to have fat, but bone and muscle weigh a lot more than fat. So when people come at me with BMIs, I almost want to throw up. I'm so sick and tired of hearing about BMI. You could have a BMI of 18 like I used to and be a little sack of fat and be extremely unhealthy with fatty liver disease and PCOS and diabetes. So we're really about body composition. But over the last 3 years too, he's been able to maintain a 45-pound weight loss, and it still keeps trickling down over time, which I think is really great. If you can maintain a 45-pound weight loss for a few years, I think you've definitely found something that's working well for you. He's also lost 10 inches around his midsection, and he's been able to maintain that for the last few years as well. So case number 2 is Mr. Solitary Kidneys. So I chose to emphasize a couple of kidney patients here because I get emails from kidney people all over, or all of the time, saying, can we really do this diet lifestyle for us, or is it too dangerous because we have kidney disease? Well, we're the kidney guys in Toronto, so the majority of our patients do have some degree of kidney disease. So he only has one kidney, and the other kidney is stage 4 CKD. He joined us in November 2015. So he hasn't been with us for too long, and he was 67 when he started. He was diabetic since 2005, and he started insulin the same day he was diagnosed with diabetes. Well, this man literally discontinued 70 units of insulin overnight, and he didn't require any oral diabetic medication after that. And he was only doing a very mild fasting regimen of 3 24-hour fasts a week. Initially, when he came into the clinic, we asked him to do 7 days of fasting because of his higher insulin dosage. And his numbers dropped so quickly and stayed down, he couldn't fast beyond 24 hours. And he also follows a very moderate low-carb diet, and he does skip breakfast on his eating days. So his A1C has gone down from 6.8 to 6. He's lost 21 pounds and has been able to maintain his weight loss. And he's lost 6 inches around his abdomen. And then we have case number 3, and she'll conclude my talk today. This is Mrs. Cherry Confessional. Last year, she binged on cherries and came in crying. I thought she was going to ask me how many Hail Marys that she had to do. But she was just a borderline diabetic. She was on a little bit of metformin. She discontinued the metformin immediately. She has been doing 36 hours of intermittent fasting a week, 3 times a week, and she's followed a low-carb diet. Her A1C has gone from 6.2 to 5.2. She's lost 70 pounds. Every time I see her, she's down in weight, and she's only ticked off that she's down 5 pounds each time. And then everybody laughs at her. She's lost 12 inches around her waist. All right, so just a few take-home messages. Fasting is like a muscle. So if you were to go into the gym after not being someone who's gone to the gym in a really long time, you wouldn't expect to leave that gym that day looking like Ted Nyman, right? You start off slow, you start off gradually, and you work your way up to being able to do longer fasts. So listen to your body. Your body will always tell you when you've reached a threshold that it doesn't want to pass quite yet, and let the fasting happen naturally. And also, what's really important is don't forget to eat. Eating is very important. When I eat, and I eat a lot of great fatty foods. And always change things up. Don't get into doing the same thing on a day-to-day basis. And just keep in mind that it's all about progress and not perfection. So that's it, guys. Thank you for listening to my talk today. And happy fasting!
Great job.